Good morning. Thank you all for joining us. Last week, we announced our first steps towards reopening Baltimore County businesses that have been closed as a result of the pandemic. Those initial decisions, which we had about 24 hours to determine in the wake of Governor Hogan's announcements, were made in the best interests of public health. At that time, we said that Baltimore County would reevaluate restrictions as we were able to increase the availability of PPE, further expand testing, and make progress in ramping up our contact tracing efforts. Since last week's announcement, we have spoken to stakeholders, including public health experts, business owners, and residents. We have continued conversations with leaders in our neighboring jurisdictions who also face challenges due to Maryland's abrupt change from a statewide reopening process to a county-by-county approach. And in just 1 week, we've seen significant progress on the key indicators I outlined as necessary for helping to keep people safe and to minimize the spread of the virus. Earlier this week, we announced that Baltimore County is purchasing and now stockpiling large amounts of PPE to provide to our nursing homes, which are some of our hardest hit and highest risk neighbors who have had difficulty in securing safety equipment. Later today, Baltimore County will be the first jurisdiction in Maryland to offer appointment-free testing at the Timonium Fairgrounds testing site. This is a significant step forward. It's especially important because Maryland has lagged behind other states in testing rates, even though we all know that significant testing is a key factor in reopening safely. In Baltimore County, we've led the region with over 35,000 people tested and with the lowest positivity rate among our large jurisdiction counterparts. With appointment-free testing starting to become available, and with the state's new steps to allow pharmacies to administer tests, we expect to see a significant increase in testing and an associated decline in our positivity rate. In addition, Baltimore County is in the process of finalizing an initial round of hiring for additional contact trace investigators, and we expect to have these staff on board in the coming weeks. Thankfully, they've been able to acquire critical knowledge in this area, allowing them to hit the ground running, thanks in large part to Johns Hopkins and the Community College of Baltimore County for offering free online training programs. Each of these developments on their own are important steps. They make Baltimore County much better prepared to navigate this rapidly evolving situation and to more safely deal with the challenges we know that are likely to be associated with the reopening process. And that's important because we know that we do not operate in a vacuum. The governor's orders have created a patchwork of rules, and now Baltimore County businesses face restrictions that no longer apply to some of their competitors nearby, some just a few minutes away. What's more, we know that our residents are traveling to businesses in other counties while our establishments remain closed. This not only puts some of our small businesses at a competitive disadvantage, it also has the unfortunate impact of limiting the public health benefits our own restrictions have. After considering all of these factors, today we are announcing the next steps in the reopening of Baltimore County. I've just signed an executive order so that beginning tomorrow at 9 a.m., retail establishments under the governor's Phase 1 announcement in Baltimore County will be able to be open to customers. In addition to state restrictions, they will be required to limit the number of people in their stores to 10, including staff. All individuals must wear face masks and adhere to proper social distancing. In addition, tomorrow at 9 a.m., barbershops and hair salons will be able to open, consistent with existing state restrictions for hair services and by appointment only. These establishments will also be required to limit the number of people to 10, including staff, and they must take proper safety precautions, including masks, social distancing, and disinfecting surfaces as appropriate. Also, per the governor's orders, other personal services, such as nail salons, massage parlors, tattoo shops, and tanning salons remain closed. We are confident that these steps can be taken in a careful way that protects all customers and staff, and I believe that this is in the best interest of Baltimore County at this time. I also want to take a moment to clarify the situation for religious institutions. The restrictions that were in place for all religious institutions in the state prior to last week remain in effect for Baltimore County establishments. That means that the restriction of gatherings of 10 or more people remain in place, either indoors or outdoors. And religious institutions may hold drive-through or drive-in services, as some have done. Under the state's orders, religious institutions who ask their congregants to remain in their vehicles would not be limited to the overall restriction of 10. All of these steps are in line with the state of Maryland's Phase 1 steps, with only one key distinction. Health experts have consistently maintained that gatherings should be limited to no more than 10 people whenever possible. Gatherings of 10 are discouraged by federal guidelines, and they are barred by order of Governor Hogan. And so, consistent with that public health guidance, Baltimore County is also maintaining that standard. Our goal is to reopen, and to reopen as quickly as possible while also promoting the health and the well-being of our residents. I want to be very clear. While we are taking additional steps toward reopening today, we are by no means out of the woods. All residents should continue to take all possible precautions to protect themselves and their loved ones. While Baltimore County and the state of Maryland does not have a stay-at-home order, you should know that you are still safer at home. This is especially true for our most vulnerable, our seniors and those with underlying health conditions. So please, continue to stay home whenever possible. If you must go out, wear a mask and keep 6 feet of distance from others. It's important for our residents to understand the only way we can continue making progress toward reopening is by continuing the hard work of social distancing. This is a crisis the likes of which we have never seen, and it requires all of us to do our part. And we will all get through this together. Thanks. Hey, Jennifer. Yeah, so this is consistent with federal guidelines, and it's the governor's orders of limiting gatherings to 10 as well. So we're keeping our guidance consistent with federal guidelines as well as the state's order on gatherings. Scott.
Baltimore County is involved in the thoroughbred racing industry, Are you concerned that even with protocols in place and elsewhere within the governor's guidelines, that there's really been no roadmap for the reopening of thoroughbred racing in Maryland?
Yeah, we continue to convene ongoing conversations with all of our industries. We actually have an agriculture sector industry call coming up. We've talked to our major employers in Baltimore County. We've talked to retailers in Baltimore County, our members of our commissions and our work groups. So we certainly want to have a roadmap for all of our industries, horse racing being important among them. I will tell you that prior to last week, we were in a very good place to implement what was being a state-driven process for reopening. Last week, we were asked not just to implement decisions, but actually stand up the infrastructures to also make those decisions. So we are actively, around the clock, working on those protocols and having those conversations.
All right, thank you all.
Go ahead, Jennifer.
Say one more, yeah.
What about the testing today? Get tested through the suicide.
I'm going to actually defer to Dr. Gregory Branch, our health officer, and let him answer the question on testing. Thanks.
Good morning. We are anticipating approximately 1,000 people on today at our testing site in Timonium. 1,000 for today, right, yes. And obviously as the testing has now opened up, we're expecting a lot more people to come to our testing sites. And so we're very glad about that. That's something that's wonderful, because the more people that we can test, the more we're able to actually now put this disease at bay. Anyone who gets their testing done with us at this particular time is going to be 24 to 48 hours.